Right. Welcome to our Corporate OD Alliance Facebook Live event. Today we are talking about the value and importance of giving back to our communities. So I'm just going to pause for a minute just to allow everyone to join. And I just want to encourage everyone to comment throughout the event if you have any questions or share your support about this event. Again, I would like to welcome and thank you all of us for joining today. This is the importance and benefit of charitable engagement for eye doctors, and it's a subject near to my heart. We take our oaths as optometrists to pledge and strive to see that none shall lack proper care. Serving those in need can benefit not only our underserved patients and our communities, but ourselves and our practices too. CODA has teamed up with the Essilor Vision Foundation to bring you this meaningful discussion today. Providing charitable vision services and support is something Essilor Vision Foundation has had a lot of experience with. Since 2007, Essilor Vision Foundation has provided 1.5 million pairs of eyeglasses to individuals in need. They are committed to eliminating poor vision and its lifelong consequences as they partner with eye doctors and nonprofits all over the country to support them in their charitable endeavors. Its program and support, like the ones the Essilor Vision Foundation provides, can make it easy for optometrists to give back to their communities. But before we dive in and why it's so important and how meaningful and easy it is to do so, I want to introduce the panelists joining me today in this discussion and sharing their thoughts and experiences. First of all, we have Dr. Stephanie Johnson-Brown, who received the Doctorate of Optometry degree from Illinois College of Optometry in 1978 and a Master's in Education from Erickson Institute, La Jolla University in 1987, and currently practicing in behavioral optometrist at. Recently, Dr. Johnson served as Clinical Director of Tropical Optical Chicago Public Schools Mobile Vision Program and served as President of National Optometric Association. In addition, Dr. Stephanie, as she's finally called, is Executive Director of Plano Vision Development Center, nonprofit vision service corporation, which specializes in vision education and identification and remediation of vision development programs in children and adults. Next, we have joining us is Dr. Ryan Parker. Dr. Parker graduated from Oklahoma College of Optometry at Northeastern State University in 2004. In 2018, he joined Essilor full-time as Director of Professional Development. Dr. Parker has been featured in many articles, television interviews, talking about various programs and technologies that Essilor utilizes to achieve its mission of improving lives by improving sight. He lectured extensively on practice management, spectacle lens technology, myopia management to numerous eye care professionals. Last but not least, we have Miss Becky Palm. Becky is President and Executive Director of Essilor Vision Foundation USA. She is in her third year leading the foundation and a long history of commitment, passion, contributions to charitable causes. She is proud to now focus her efforts on the Essilor Vision Foundation and its missions by helping raise more awareness about the cause of vision and provide partners and eye care professionals access to tools and resources to make vision more accessible and affordable to increasing number of people across the country. Thank you all for joining me today.
Thank you for having me.
As a reminder for those joining us, I want to thank, we're talking about the importance and benefit of charitable engagement for our communities and engage you in the comment throughout the event with your questions, personal stories, and just share your support. So let's get started on our first question to the panelists. As I mentioned a bit from the optometric oath we take, my first question is to you that we take as an oath as doctors. Call us to give back to our communities. Dr. Stephanie, why don't we start with you?
We take an oath to serve our patients and hopefully keeping that in mind regardless of their ability to pay. We hope to keep that frontmost. And that's one thing that I've been dedicated to my entire career is servicing those patients, even if they are not able to pay fully for those services. Where there's a need, I'm going to serve.
It's really great to see how you're inspiring and giving back, Dr. Stephanie. Dr. Parker, what are your thoughts on how our oath calls us back?
Yeah, to echo on what Dr. Stephanie just said, as optometrists, we are a leader in the community that we're in, and the definition of community can be different. I practice in rural Oklahoma, a smaller community. As optometrists were leaders, and I think we need to lead by example. So giving back is a great example. You can, if you get more people on board, it snowballs, and ultimately your community gets better, and your community will prosper. And even for those people that are watching that maybe, well, I'm in a gigantic community, you still have a sub community in there, and you have people around there that you can influence. And that's why I think it is so important to give back, because the influence it creates and leading by example.
Yeah, that's very insightful, Dr. Parker. You're right that optometrists are leaders in our communities, and I think we should take it seriously because it really ties to the optometric oath. I know that when I was thinking about this question, what comes to mind as well is also balancing running a business and giving back, because community supports you, and you should be supporting your community too, to help grow the community as well as your business. This brings us to the second question. In the current environment, how has the need for philanthropy changed? Let's start with Dr. Parker on this question.
Sure, Dr. Sampaulos. Definitely the need hasn't gone away. In fact, it's probably worse than it ever has been. There's more people in need of our charitable services. Once again, I think the problem is, though, with all of us trying to run businesses and do our things, maybe our thought, we still want to do it, but it's taken a backseat to other things. I know a lot of doctors that I talk with are having, problem finding great staff right now. And the thing is, I want us to all energize and refocus, because once again, we can lead by example here. And if other people see us taking the time, effort, and energy to do charitable work and give back, even when a time where so many things are going on, just remember that need has not decreased. I think it's increased, and it's our job as optometrists to lead by example. Hopefully other people will follow, and then we can meet this ever-growing need.
Yeah, that's a great perspective. It's a fact that the need hasn't diminished. It's probably grown from the last time. So, Dr. Stephanie, how do you feel that it's changed?
I agree with Dr. Parker. The need has not decreased. In fact, it's increased. I practice in urban Chicago, and there are many, many neighborhoods in need. And the need is there. And yes, in the city of Chicago, we have a lot of our patients who actually are recipients of Medicaid. And you would think, well, they have a way to pay, but access to care is important. So the need is there, but sometimes for whatever reason, they aren't able to get to that service. So organizations like the Essilor Vision Foundation in supporting doctors who want to give back to their community and providing these comprehensive exams, and Essilor Vision Foundation providing the glasses, I think the need is even greater now, especially coming off of the pandemic.
Yeah, that's a great point. Just because things have slowed down and now they're starting to get back up, but patients still need services. They need glasses. Becky, the Essilor Vision Foundation has been helping people for a long time. Have you noticed a change?
Well, I'd say I'd echo what Dr. Parker or Dr. Stephanie have indicated in terms of the increased need. If anything else, we know that many already had a need, but then there are families that may have previously had insurance that have lost insurance when they lost their jobs, in a different position. Again, the landscape has changed a lot, not just since COVID, but in the middle of COVID, as schools, many went to virtual, finding ways to provide that access, as Dr. Stephanie mentioned. So, we reimagined, got a bit creative. We, of course, continue to work with schools as possible, but also really engaged in community clinics, tried to help the families, as sometimes our programs are geared towards students or towards specific organizations, but really making sure that we can open it up to serve as many people as possible. While some of it's anecdotal as far as the perception of increased need, we know it's there. One small story I'll share is we were resuming clinics in the fall, and it was right around early voting. And so you have the early voting locations, and we had agreed to do exams in connection with screenings at a school district nearby. And based on the pre-screening information, we were told to expect about 50 children or families. And we showed up, and there was a line around the building, and we thought we were at a pre-voting location or early voting location. And come to find out that actually was the line for our services, and it was not 50, it was 500. And so we ended up obviously exponentially serving, and to the extent we could not provide exams that day, we coordinate with the school to provide exams at future dates to serve all of those in need. And that, I think that's really telling when you have a community that is trying to take precautions in a COVID environment, but understands that the significance of vision and sight, and is coming out at, lining up and waiting to get our services. So I like to think of that as kind of an example of what's possible. And if we can provide access points and charitable opportunities, that there's a lot of need that we could serve.
Yeah, it's great that the Esler Vision Foundation has so many doctors across the country that can help, resume their charitable work. I mean, a lot of doctors, it's very easy to get involved. I mean, for me, I would say like the increase in charitable work has changed because of job loss and, supporting a whole family as a whole. So, it is a great time for doctors to get involved. I'm going to go to the next question. While it's interesting to reflect on how many changes recently, and it's always been a need, but the reflection for charitable outreach, can anyone share a story on how it impacted a patient and you? And we'll start with Dr. Stephanie on this first one.
Well, I'm going to share a story because I worked so heavily with the Mobile Vision program in the Chicagoland area. I had a little boy, maybe 6 or 7 years old, and I was providing these exams to him, and he ended up with a prescription that was maybe a +6, and he had glasses, and I asked him, where did you get these glasses to help with your farsightedness? And he goes, oh, my grandmama went to the dollar store and she bought them for me because we didn't have any glasses for me. So my heart just broke, and I was just so excited that we were able to come to his school and provide this exam on site to take that one worry away from his grandmother.
Yeah, that's an amazing story, and thank you for the work that you do. It's such a great perspective that people that need glasses that can't afford it in a struggle, and just with access. Dr. Parker, do you have any great stories that you like to share?
Yeah, the good thing is because of charitable work, there's so many, and I go back to those stories on days that stuff gets rough, and they're good to think about, just like Dr. Stephanie's story. That's awesome. Mine's just a bit different. Mine goes back to a little older patient named Judy. Judy came to me from another practice, and Judy's deaf and a lip reader. And Judy came in with a macular hole in one eye and great vision in the other eye. And we just had a conversation about, what happened with the right eye. And she's like, I don't, I'm covered under the state's basic minimum, low, poverty level insurance, and there's no bells and whistles. And when I had issues in my right eye, I just didn't go in. Okay. And I told her, I said, no matter what, don't worry about it. You're in a different class of patient for me. You're high risk. I don't care. I don't care what happens. I don't care what it's going to cost. We'll figure that out down the road. If you ever have a symptom like that in your left eye, call me. Don't worry about it. And I saw her for a couple of years, and I always had that same conversation with her at the end of every exam. Sweet lady, just absolute pleasure to be around. So sure enough, on one day, it wasn't a Friday, but it was towards the end of the week, she called and was kind of hesitant to come in. And I said, I don't care what you're doing, right? Just drop it, come on in. And sure enough, we did, we ran an OCT and those type things, which were not covered under insurance plan, but I didn't care. And sure enough, she had an impending hole on the left eye. And I got on the phone and called as many surgeons as I possibly could. And fortunately, I got a hold of a retinal surgeon that also eye to eye with me on certain charitable cases. He agreed to get her in that day, which is crazy, and ended up doing a great surgery, stopped the hole, repaired it, 2015 vision. So a year or two goes by, and Judy kept referring patients in because I would, we'd see on the chart, who sent you in, and her name came up a lot, but I didn't think anything of it, just, because we got along well. A few years down the road, I actually met her son at another event that was in town, and he came up to me and said, "Oh, you're Dr. Parker." I said, "Yes, sir, I am." And he said, without hesitating, "You saved my mother's life." And I laughed a little bit because there's another Dr. Parker in town that I practiced in that was a surgeon. And I thought, oh, you've got us confused. I'm not a surgeon. And he goes, no, sir. My mom reads lips. That's the only way she can communicate. And she's told me on multiple occasions, had the same thing happen to her left eye that happened to her right eye, she wouldn't have the will to live anymore. And it stopped me cold in my tracks. And it reminded me the importance of what we do is not just vision related. It's overall health and wellness. And being able to give back in that situation is something that has impacted me, and I will never, ever forget that story as long as I live.
Wow, thank you, Dr. Parker. That's a heartwarming story to hear about people's lives and how you've changed it. I'm sure a lot of optometrists all over the country change people's lives all the time. So, Becky, I know that you help a lot of people through the foundation. What is a story that you can share with us that's really impacted you?
So I definitely have the benefit of seeing lives changed every time I'm involved, and that's probably more than the average bear. But interestingly, the story that really sticks with me the most is actually happened when I was volunteering with the foundation many, many years before I came into this position. So I kind of think it's my foreshadowing. I was volunteering with the foundation at one of its annual fests, probably in 2013, 2014. And it was probably my first time at one of the events. And so I was trying to get acclimated. I had just joined the vision industry. And so I wasn't familiar with all the equipment. So I did a quick training and I sat down with auto refractor, and I hadn't gone through many children. And a little girl came up, and she was quite wiggly. And a lot of kids have a lot of energy. You know, they're really bouncing off the walls by the time they get to their first stop. And I really had a hard time with her. I was like, okay, I know that I can't do the auto refractor if they don't stay still. So I got one take and it said, -20 in both eyes. I thought, I'm clearly messing this up. So I tried again. I had called somebody over, tried again. I called an EVF team member over. I said, can you do this? I don't know if I'm doing it correctly. And, they ended up getting the same outcome every time. And so we flagged some of the participating kind of staff members and doctors, and escalated her right to the front, getting her vision exam. It turned out she had glasses at one point in time. We don't know how long ago she'd had them, but we're just thankful that she'd come to the event so she could get a proper exam and then a referral and get her the care she needs to obviously avoid getting detached retinas, things of that care. But it's just, even talking with her, I was trying to engage, and I was asking her the big mural behind me what it was. It was like a whale. It was something pretty easy to spot, and she just had no idea what it was. And I just think about trying to learn and how that impacts her life. And I'm glad that we can do things like we do at the foundation and with the help of charitable doctors, because I know that we absolutely change the trajectory of a child's life when we're able to provide them with the simple thing as a pair of glasses.
Yeah, that's a great story. Even through every glasses that we can provide, doctors improve quality of life for patients, even in some extreme cases. So I want to remember talking about like one of my times. I have patients from Rhode Island Free Clinic come to my office. You do free eye exams and in the script. But I had a patient come in. She was a young girl, never had an exam before. And then you refract to do the exam. And she ended up being a +5, right? And just put on the glasses, just the impact that it made in her life, and seeing your patient smile and just notice the difference of what they can see and what they're supposed to see. It makes a difference. We make a difference in patients' lives all the time. Just like Dr. Parker said, you don't even realize that you're just doing your job, and you make such a big impact. And it helps these patients throughout their life. So, but it's not just doing good and getting a pair of glasses to change people's lives and people in need, but doing good is good for business, right? It's also something I want to explore now. Let's start with Dr. Parker. How can provide charitable vision and positively impact a doctor in their practice?
Yeah, I love what you said. It's not just doing good, but it's good for business. I mean, it's all about the perception as people view you. What are you doing to make your community better? What are you doing to make the lives of people that you serve better? And I noticed, once again, I practiced in Southern Oklahoma, so relatively small town, 15 to 20,000, and we would do community events, and those type of events where you have all kinds of different providers that are there doing different things. And a lot of time we're around back to school time, trying to get kids ready for school with dental and health screenings and eye screenings. And I always did those. And what's interesting is you have other leaders in the community that are alongside serving. And I can't remember one where I didn't gain a patient out of that. And I practice in a town with a lot of competition. And there were times when I knew that person was seeing one of my competitors, but they saw our office taking the time out on a Saturday or a Sunday to give back, and they're doing the same thing, like-minded individual, and they want to align themselves with someone with similar type views. And that's how it was good for business for me in rural Oklahoma. It was just increased referrals by being active in charitable giving.
Yeah, that's right. Charitable work can lead to referrals, and whether it's you serve with or just patients you're working with in general in the community that you mentioned. Dr. Stephanie, how have you seen doing good for business?
I agree so much with Dr. Parker. That is so true. When people see you servicing the community, it's kind of like a magnet. They want to also do it, whether it's other people doing other types of service, but also your colleagues kind of want to jump on the bandwagon. So I think that is really good for business. I have gotten a tremendous amount of referrals, and I think it's because with community service, they see care. They see that you see them as more than an eyeball. They see that you see them and their family, because with those community service events, it's like a whole family type of event. And you're right, Dr. Parker, they do refer, not only they continue to refer patients to them, but then you see generations of that particular family. So the service piece has been really big as far as helping to grow your practice, but also helping you to be someone that in an office that stands out in the community. And I think with a good image, not stand out with a bad image, with a good image of care and service.
Yeah, that's very insightful, Dr. Stephanie. It's great to hear how the SLR Vision Foundation has Life Through Lens program has changed and helped people give back. So, Becky, I know you don't run a practice. SLR Vision Foundation works with doctors around the country. Can you just give us some insight on how it's good for business?
Absolutely. So, we of course focus our programs and our offerings to do just as Dr. Parker and Dr. Stephanie mentioned, which is to help doctors, provide them with the resources and the tools to not only be charitable, but more importantly, weave that into their practice and let them, be the heroes in the community. We have done surveying and we've really done a pulse, and based on what we found, more customers than not, over 60% of customers are more willing to align with a practice that is ingrained with the cause and giving back to the community, as they both stated. That's a distinguishable piece, and especially with the millennials and some of the younger population as well. It's a big factor in their selection process. But more importantly, it's a nice way to organically weave something that's already part of your values and your culture based on the professionals that you are, really trying to stress the importance of vision care and providing access to everyone to have that. But by using a program that's easily accessible, we try to focus on not just providing product, which is very easily to assume when we're talking about SLR Vision Foundation, but really resources, marketing material, et cetera, that you can also incorporate into your social media, into your practices, the door clings, wherever that you want to just kind of message out what you're doing in the community.
Yeah, it's interesting, but it's also remarkable, right? Because you make such a big impact on the community, but also in the bottom line, you practice with referrals. In my experience, besides just that, more patients come in, but morale goes up in the office, right? So staff is involved in something bigger. That's just not just the business. We're here to help the community, help people, makes you feel good, bring staff morale up. So it's important too, because people want to be part of something. People want to make an impact, make a difference. And this is a great way in a small area to do so in your community, and get staff involved too. So I know that it makes doctors feel like a lot of doctors don't feel like they have time to do a charitable work or don't know how to start. Becky, can you talk to us a little bit how doctors can about the program and how they can support the SLR Vision Foundation and what it can offer to doctors for engaging in charitable vision services?
Sure. For me, I just want to point out that our goal is to support them. I understand there are a lot of competing priorities. I've spent a lot of time over the last many months talking with Dr. Parker and Dr. Stephanie, just trying to understand so that our programs and offerings help support doctors as they're rebuilding or expanding practice, trying to regroup, get their patients in, but at the same time, really continue that charitable arm. For us, we have several programs. Some of them are awareness, just building off the simple notion of trying to better understand vision care and what it's about. Dr. Sampoulos talked about just incorporating in the morale of the practice. Our See Kids Soar program is a wonderful program that does just that. It is an awareness program and messaging that you incorporate into your practice that the entire staff and team can get involved in and incorporate in terms of educating your customers and those in the community about the importance of vision care and children's vision in particular. We include in that in the marketing kits that are free, a lot of different assets that can be used online, in person, and otherwise, just so that you have the intention of doing good, but you don't have to do all the heavy lifting of the marketing and creative that is done for you. And you really can just amplify the messaging. And again, just kind of bring that goodwill and the cause into your practice. And many of you are also, I'm sure, familiar of our Changing Life Through Lenses program, as has been mentioned a few times. That is an online resource that is available. We've got practices participating in all 50 states that allows ODs to participate in requesting charitable frames and glasses when they give an exam to those in need. They can work through their practices, or they can work in connection with nonprofit groups or other groups in the community, and really allows you to forge some great partnerships, whether that be schools, churches, other community organizations, or clinics. So, you don't necessarily have to identify yourself, but you can work with those groups that may have identified, but they need the resources and partnership. And again, creating that goodwill arm. You can look for more information on that on evfusa.org. And I'm also excited today to talk about a relief program and campaign that we just launched that's in connection with Changing Life Through Lenses. That's called Changing Life Through Lenses Relief. It's quite obvious since I just said it, or CLTL Relief. And that is a campaign that launched the beginning of June through December in an attempt to hope and increase engagement and get those that are interested in participating more in their communities by providing some funding to help better support their practices, help with the time associated with identifying and qualifying patients. And again, over the next 6 months, you can earn up to $1,500 to put toward those efforts, or as you need to in your practice. And for more information on that, you can go to evfusa.org/relief. We hope that you'll consider signing up. Again, a myriad of other options at evfusa.org as well, whether they just be awareness or ways that you can provide access to those in need. That there are lots and lots of options where you can always reach out and we can talk about more, because our goal is to support you. We could not reach 1.5 million and more kids and people in need that we want to reach without you. So thank you.
Oh, thank you, Becky, for all that information. Well, that concludes our discussion for today. I hope you all found this fun and enlightening as I did. I hope it inspires you, and I call you all for watching this to take your oaths to heart, serve those your community and for their benefit, as well as yourself and your practice. Don't forget to check out the Essilor Vision Foundation's program at evfusa.org. Huge thank you to the panelists today for sharing their time and insights, and thank you all for joining us today. Thanks, everybody.
Thanks, everybody. Bye.